Hey there, Dr. G here with a quick tutorial on what you need to do when you get your medications, either from Lilly Direct or from Novo Farm. It's kind of a mixed bag here, but actually you'll get the vials from Lilly Direct and you'll get the auto-injector pens from Novo Farm, but I don't have all that set up here. I have the dummy pen, which is an auto-injector pen from Lilly Direct, and this is the vial. Obviously, it's not real medication, but this is filled with saline. I'm going to show you how to draw up the medications when you get them. So basically, vial, whatever you get in a vial, I'm going to show you how to draw it up, and when you get the auto-injector pen, how to use it for the very first time. Super easy to deal with on the auto-injector. So here we go. Auto-injector pen. Simple, it's got a cap on here, it's got a safety cap, it's got a safety lever that goes left and right, lock, unlock. You pull this off, you find the area of your skin. We're gonna use the table here, the desk here, for as the flat area of your body, either your abdomen, the anterior thigh, or you can use the back of your upper arm. And you hold it flat to the skin, you press the button. Well, first, let's go. You gotta unlock it. Unlock it, press the button, and it's going to move. And it's going to inject the medication that's inside the pen into your skin, just underneath the skin in the subcutaneous space. Super simple if you get the auto-injector. Ozempic, made by Nova Farm, is being sent in the auto-injector pen, and you can get those. This is if you were going direct to the pharmacy, right? To the pharmacy company, basically Nova Farm, right? So your doctor or your provider, whoever is scripting this out for you, sends this script over to Nova. Nova Farm calls you or contacts you, gets payment, and they ship this to you, right? They ship the pens to you. The 0.25, 0.5, 0.75, 1 milligram vial. So you get all the pens, right? So these are auto-injector pens. Pull off the cap. Again, you unlock it, put it flat to the area that you're going to inject, be it the belly, the anterior thigh, or in the back of the upper arm. You press the button and hold it there, don't move. Little small stick, and then it automatically retracts in. Super easy. And these have been, pretty much everybody's seen these by now, either on a commercial or in real life. And these are running around all over the country and the world. So that's the auto-injector pen, super easy. Let's go ahead and just don gloves just for, I don't know, I'm just used to it at this point. Just put gloves on if we're gonna put on, we're gonna draw up meds or slash, even if it's dummy meds. In this one, we're gonna do saline. There's saline in here. Little cap, put the cap back on. So just go ahead and pop the cap off. I just push this back on just for, just to make sure we make it as real as possible for you. All right. First, before we do that, let me show you something. Woo-hoo. In the office, we've gotten our compound medications, our compound semaglutide. This is how it came. The semaglutide would come in 2.5 milligrams in every vial, in every one of these things, right? In every vial. We would get 2.5 milligrams in the vial, and the vial had 1 ml of fluid. So 2.5 milligrams in 1 ml, right? So in every 1 ml, we got 2.5 milligrams of medication. Therefore, if you want to get 0.25, you divide 2.5 by 10. You divide the 1 by 10, so in every point, you get 0.25 milligrams in every 1 ml. Super simple, right? That's the 1 ml syringes. These are these, right? 1 ml syringes, it's 1 ml. They have 0.1 through 0.9 to 10, basically 1 ml, right? And then this one, if you get the same thing, 0.25 milligrams in 10 units. So in every 10 units, you would get 0.25 milligrams. So if you wanted 0.5 milligrams, you would do 20 units. If you wanted 0.75 milligrams, you would do 30 units. If you wanted a full 1 milligram, would be 40 units, right? Easy. Then again, if you wanted the whole 2.5, which, is a dose, you can do that. would be the whole syringe. It'd be 100 ml, the whole syringe. So 0.2, you multiply by 10, you multiply 10 by 10, and you get 100 units. And that's what you would do if you wanted to get the whole 2.5 milligrams. Now, I went over that really quick because I want you to understand that every one of you guys out there are getting different concentration of the vials. You got to do this math. Typically, if it's a good compounded pharmacy, or in the case of Lilly Direct, they'll send you an actual piece of paper that tells you exactly what is what, right? But a good compound pharmacy already does this math for you, and you can, do what you need to do. That's all I need to say about that. So don't ask me about milligrams and how much is this and that in the comments, because I don't know. I don't know what your vial has in it. That's up to you and your provider and your compound pharmacy. That's not me. I can't do anything about that. I'm not gonna sit there and do the math. I've done it before, can't do it anymore. Anyway, so we pop the cap on this, right? You're supposed to pop, I put this back on pretty good. Cap's back on, right? Cap's on. Supposed to, we do this in the office, but you can do this at home. Just wipe it, just, extra, wipe it with alcohol, swab. Don't have to this step, but it's good practice, right? So first, we're gonna draw up with the insulin syringe, right? The insulin syringe. I'm gonna draw up 0.25, and we already did this math, right? Already did this math, just did it. It's 10 units to get 0.25 in this insulin syringe of a 100 unit insulin syringe. So you just do that, right? Let me put my eyes on. So now we got the needle exposed. You invert the fluid in there, in the vial, stick it right in, boom, right? We're in there. There's this little slit on the side. If you really can see, if you go all around, the rubber has a slit on the side, and you can, and you gotta pull off the safety orange thing, right? And you can see where the needle is in the fluid. Then you start pulling back, right? And you're gonna pull back just 10 units. Just so the black part of the plunger meets 10 units. So now we got 10 units loaded up on this syringe. Pull it back, and there you go. Ready to inject. That's one. Easy to go, right? Same rubber stopper, we're gonna wipe it again. I'll pull off another one. So the YouTube, please don't come for me. Wipe it, set that there. Let's get their garbage together, all in one place. Right? Now we're gonna get our 1 ml syringe out, right? So I'm gonna crack this bad boy open. There we go, right? This bad boy is open. Now, difference between this syringe and this syringe is obviously the needle is already loaded on the insulin syringe, happens to be on the ones we have in the office. Not always the case, but it's already loaded on it. This one has no needle on here, right? So I've got a load of needle on, and I've got this 30 gauge, 1/2 inch needle. It's like a mosquito bite. It's nothing more than that, right? It's the same gauge as the one that's already loaded on our insulin syringe. So it's a great injecting subcutaneous space type needle. You just twist it on now, do a quarter turn, and now it's on, right? And all you gotta do is pull it off, pull back, boom, exposed. Same type needle that we already had before, right? Same type needle. Again, same technique. You hold the vial upside down, you put the needle in through the little circle there, that's right through the middle, and you can see there's a little slit here in the rubber that you can use as a guide to see exactly where you are in the fluid, and pull back, and then you're gonna get fluid. And we're gonna pull this back to 0.1 to equal the same 0.25 that we already pulled out in our insulin syringe. Pull it back and set it down. So both of these are ready to inject. They would be ready to inject if it was real medication, but it's not, it's just saline. But we can inject those, right? We can inject those into the abdomen on either side of the belly button, about 2 to 3 finger lengths if you want. In front of in the anterior thigh is another place that you inject either Zepbound or Wegovy. And the last place is in the back part of the upper arm. So that's in a nutshell, because I know a lot of you guys are getting these things, they're coming in the mail, either from Lilly or from Nova, or you still have some folks that are getting stuff from compounded pharmacies. I won't tell if you don't. And this is how you need to prepare it.
She is one of the patients that like to get her injections in the umbilical area, and that's where we're going to inject her now, okay? So first, thank you. She's a pro, so she knows exactly what we're doing. We wipe the area. And grab the belly and inject the dose. And that's it. Pretty simple. Anyone can do it. If you do it the right way, it won't be, shouldn't be painful. Sometimes you will have a little bit of redness in the area. Other than that, you shouldn't feel anything else.
Listen, if you need more support, or if you'd like to know more information about lifestyle modifications, GLP-1s, you need a community, try the link in the description. You got a 14-day boot camp that I put together with food and nutrition and tips to be successful. We've got a link for an option for you to go ahead and join our lifestyle modification community, which is booming these days. So it's up to you to make the changes that you need to make. Listen up, stay healthy, stay informed, and I will see you soon.